Our analysis shows us that 56% of all our confirmed cases were imported and only 44% have been locally transmitted. With support of Kenyans, we are working flat out, including taking unpopular measures to limit the spread of transmission. So far, we have succeeded in containing the imports, and in the last few days, the very few cases are emanating from our regional quarantine centers. Therefore, fellow Kenyans, we are now worried about local transmission. We shall utilize our community health volunteers in community-based surveillance for coronavirus. In addition, we've ensured that we have deployed public health officers and other multi-agency teams in manning roadblocks together with our policemen. We have activated the Nyumba Kumi initiative, and further to this, we shall now utilize technology in tracking and surveillance of any members of the public who are congregating post-curfew hours. We continue enhancing our capacity for combating coronavirus, and towards this end, we are making good leaps in expanding and spreading our testing capabilities across the country. Today, I'm glad to announce that the Moi Teaching and Referral Hospital in Eldoret and Kenyatta National Hospital here in Nairobi are now testing for COVID-19 disease. The MTRCH tests cover a scope of 22 counties, and this will enable transfer of samples from those countries, reducing the turnaround time. The two facilities have been conducting testing in the last few days and are therefore complementing the existing efforts in the other laboratories. Counties are required, therefore, to continue taking stock of their existing capacities with regards to ensuring that healthcare workers are facilitated to be able to fight against COVID-19. Going forward, fellow Kenyans, all those who break the curfew rules will be assumed to have been in contact with suspected cases and hence will be quarantined for a period of 14 days. The government will hence carry out screening of truck drivers entering and operating in Kenya going forward. This will be done at roadblocks using a combined team of health and security personnel. We have received disturbing news that some unscrupulous persons are recycling face masks after collecting them from bins and selling them to unsuspecting Kenyans. In particular, we've noticed the recycling of the surgical masks, and we've seen different pictures in social media, and we therefore say that this is unacceptable and this is actually criminal. Together with this awareness, we're going to be rolling out guidelines on the disposal of face masks, and we shall crack the whip on anyone found endangering the lives of fellow Kenyans for selfish gains. I urge Kenyans to undertake basic due diligence on face masks that they are buying so that they do not fall victim. And also we are calling on the National Police Service, the Kenya Bureau of Standards, the National Environment Management Authority, NEMA, and other relevant government agencies to come and take action on those who are recycling masks and selling them to unsuspecting Kenyans. Yesterday, we witnessed a situation in Baringo where elected leaders led a mass demonstration in Cabinet Town, thus endangering the lives of the locals. What we saw in Baringo must be condemned in the strongest of terms. Fellow Kenyans, remember, under the Public Health Act that has been invoked by the Ministry of Health, all gatherings, whether political or religious, remain banned. We have also noted that there are people who are presenting all manner of letters of authority to be able to move out of restricted areas. It is important for people to note that nobody has the authority to clear any person to move out of these areas other than the Ministry of Interior. We have also noticed that wines and spirits have been converted into drinking joints. These facilities are only licensed as takeaways only, and therefore we urge any Kenyans who may be visiting the wines and spirits to buy any drinks to ensure that this is a takeaway service only. And anyone found drinking at the wines and spirits shops will be arrested and the businesses will be closed down. Now, since our last update yesterday, we've tested an additional 1,330 cases. And out of these samples, 8 have tested positive for coronavirus, bringing the total number of confirmed cases in the country to 270. 7 are Kenyans and 1 is a foreign national, and none of these cases has a history of travel. 3 emanated from our quarantine centers, and 5 were picked by our surveillance teams from various parts of the country. 4 are from Mombasa, 3 Nairobi, 1 Kajiado, and all aged between the ages of 17 and 65 years old. I'm glad to also announce that we have 7 other discharges today, taking the number of recoveries to 67. And this is encouraging, and we hope that many more will recover. Sadly, however, we have lost 2 more, thus raising the number of total deaths to 14. Yesterday, we gave a rundown of affected areas in Nairobi County, and we've noticed that almost every estate in this county does have a case. And the situation in Mombasa is not any better. Kwa sasa, Nyali inaongoza na kesi 11, ikifuata na Mvita na kesi 7, Kisauni 7, Changamwe 2. Na kule ndani Nyali, karibu kila kona kuna kesi ya corona. Bamburi 2, Beach Road 1, Mamba Village 1, Mogadishu 1, Mkomani Tamarind 1, Maweni Kongowea 1, Twiga Road 1 na Umoja 1. Kwa hivyo huu ugonjwa umeenea kila pahali Mombasa. Ni jukumu la kila Mkenya kumshika mkono gavana wa Mombasa Ali Hassan Joho pamoja na serikali kuu kuongeza juhudi za kukabiliana na hili janga.
The Kenya Bureau of Standards has outlined the specifications and the standards for material for the production of masks. And those have been outlined and they are available for free from the Kenya Bureau of Standards website. Those and also certification for any of manufacturers who would like to manufacture these PPEs has also been undertaken for free by the Bureau of Standards. To date, we have certified 9 government institutions for the manufacture of PPEs, and 34 private institutions have also applied and have received certification. And together, those are capable of producing 1.5 million face masks each day. And these are face masks that are made of cloth. There's also work in progress in designing and an approval of ventilators by at least 5 institutions. Toyota Kenya, Kenyatta University, Dedan Kimathi University, a Numerical Machining Complex, and the Kenya Association of Manufacturers Automotive Sector. Therefore, I am pleased to announce that there is local capacity for at least PPEs and face masks. I think for PPEs, we've certified 5 companies so far, and the Ministry of Health has placed orders for that, for the delivery of PPEs. There's also local capacity for supply of hospital beds, which are available from different manufacturers, and as and when needed, we look forward to orders being placed by the Ministry of Health. Now, one of the challenges that the Minister for Health has mentioned repeatedly is the need for mass testing in the country and the absence of commodities to support mass testing. The health team has given us samples of products that are currently imported, but I think the challenge is placed before the local industry to be able to produce the materials and the sputtums for taking samples from your nose, from your throat, and for carrying. And after I've looked at it, it's actually a plastic, some plastic material. So I think the challenge is still being given to the local industry to supply these commodities so that the government is able to undertake mass testing. These samples will be available in our office, and it's also available from the Ministry of Health for those in the industry who are able to produce. We've also noted other innovations by the business community, such as, contactless sanitation and hand washing facilities. We have seen innovation for spray dents that can be utilized in markets. And I think the challenge is being given to all of us to support in the rollout of these innovations.
Up to this moment, nobody has thought of postponing the examinations, the national examinations, both the primary school exams and the secondary school exams. And to the best of the government's ability, the children are getting online learning, as I stated last week. I am aware that the parents are very, very apprehensive, but they should be fair to themselves, because government has not pronounced itself that the exam will be postponed. I also want to tell the parents that they should not be encouraged by anybody to congregate their children to learn together. The children must remain in their homes where they are safe, as you have heard from the horse's mouth, that this calamity is now in every estate. So stay home with your children, love them, and also teach them if you can, those who can teach them.